We continue with our discussion of the spleen patterns. This time we talk about spleen Yang deficiency. This is due to spleen Yang deficiency failing to warm and transport and transform and generating interior cold symptoms. It is also called the deficiency cold pattern of the spleen. Key symptoms, Qi deficiency symptoms, and deficiency cold symptoms. Clinical manifestations, poor appetite, abdominal distension, abdominal dull pain, which can be relieved by warmth or pressure, cold limbs, shortage of qi, fatigue, lack of strength, white complexion, a bland taste in the mouth, no thirst, loose stool, general edema, scanty urine or profuse dilute and white leukorrhea, a pale and plump tongue with or without teeth prints, a white and slippery coating, and a deep, slow, and weak pulse. Analysis. This pattern is mainly caused by the further development of spleen Qi deficiency, by excessive intake of raw and cold food, by excessive intake of cold or cool medicines damaging the spleen yang, by kidney yang deficiency failing to promote the spleen, or by insufficient Mingmen. Life gate, fire leading to failure of generating fire in earth. This is analysis of spleen yang deficiency pattern. When the spleen fails to transform and transport, this will cause poor appetite, abdominal distension, and loose stool. Failure to transport fluids will result in edema because fluids accumulate under the skin and profuse dilute and white leukorrhea due to water damp flowing downward that influences the thymi. Spleen Yang deficiency can generate internal cold, and this will cause qi stagnation and cold congealing, thereby causing abdominal dull pain with a preference for warmth or pressure. Generating internal cold will result in failure of warmth, leading to cold body and limbs, white or bright white complexion. A pale and large tongue or white teeth prints, whitish slippery tongue coating, and a deep, slow, and weak pulse are signs of internal generation of water cold due to yang deficiency. To summarize, the etiology of spleen Yang deficiency includes prolonged exposure to damp, excessive consumption of cold raw foods, which hinder spleen, irregular eating and eating too much, excessive mental activity, chronic illness. Underlying or accompanying pathology, spleen Qi deficiency, lung Qi deficiency, kidney Yang deficiency. Signs and symptoms, poor appetite, slight abdominal distension after food, bright white complexion, tiredness, weakness of limbs, loose stools, tendency to weight gain, feeling cold, cold limbs, edema, fatigue, spirit, physical cold, abdominal pain relieved by warmth or pressure, diarrhea containing untransformed food, pulse, deep, weak, slow, forceless, tongue, pale, swollen, wet with white coating. Treatment principle, fortify and warm spleen yang, disinhibit water. Acupuncture treatment, RAN 12 will fortify the stomach or spleen. Stomach 36 and spleen 6 will supplement spleen Qi. Spleen 3 is the yuan source point of the spleen. Bladder 20 for supplementing the spleen Qi in chronic cases. Bladder 21 to supplement stomach spleen Qi. Spleen 9 to resolve damp in lower burner. RAN 9 to supplement spleen, resolve edema. Bladder 22 to supplement spleen and resolve edema. Stomach 28, supplement the spleen and resolves edema. RAN 6 will warm the lower burner. RAN 11 harmonizes the middle burner. Stomach 22 regulates intestines. RAN 4 to supplement qi and yang. Needle with supplementation and large amounts of moxa. The advice given for spleen yang deficiency is the same as that for spleen Qi deficiency. When there is spleen Yang deficiency, it is even more important that the person avoids food, beverages, and drugs that are cold in their energy or temperature, as well as consuming things that have a warming energy, such as cinnamon, ginger, cloves, lamb, and so on. Thank you for your attention.